name's Kate. I'm a senior radiographer at Logan Hospital up in Brisbane. I am a diagnostic radiographer through my bachelor's and recently completed a professional certificate in pain science and Master of Advanced Medical Radiation Practice. And my research essentially explored what Australian radiographers understand about pain. Sophie is my sister and was my co-supervisor on that project, funnily enough. And yeah, that's essentially what's brought us together to do this work, because we really identified a pretty big gap in the literature in this space.
Yeah, and it was really just by happenstance, because my background, I feel very excited to be here as the token physio at the at this event. I think I'm the only one. I'd love to know if there's others here. But, you know, really I come from a pain physiotherapy background, and so I work a lot with people who experience pain, and particularly chronic pain. And like Kate, have had a fair bit of training in that area. I'm an APA titled pain physiotherapist, have completed a professional certificate of pain sciences, as well as a Master of Science in Medicine Pain Management through University of Sydney. So very, very interested in this space, and it was really just complete coincidence really that as we got to chatting about, Kate was talking about her work, I was talking about my work, and we kind of unintentionally had this like interprofessional collaboration that meant we were able to stumble into this area and realise that maybe we could put our heads together and figure out ways we can translate some really helpful stuff into practice.
Yeah.
So what's the starting point then for the work, to find out what radiation therapists and others do know about pain? How much do they know?
So essentially the master study that we worked on together was exploring Australian radiographers' understanding of pain. So what we've gathered from that is that there are some radiographers that have demonstrated or do demonstrate a really high level understanding of pain and clinical reasoning regarding pain, although generally evidence-based pain knowledge is generally lacking within the profession. So that was really the starting point, just to really consolidate and identify that gap. We had suspicions that given that there are poor pain understandings among many health professions, that probably was going to be the case, but we really needed that literature base and that research and the study to show that it's a problem within radiography practice. So that's kind of where that's at the moment.
Most people might be surprised to think that health professionals don't understand pain. So how is that possible?
I mean, I think most of us will have some sort of intuitive understanding of pain. You know, we've all, assuming you're not one of the very small, tiny fraction of the worldwide population that has congenital insensitivity to pain, most of us have had some experience with pain in the past. And I think the way that we've historically thought about pain makes a lot of intuitive sense. You know, we've always kind of associated it with just tissue injury, and it makes sense why that is, but what's becoming clear is that unless we have that really sort of targeted education and we actually share our more recent research that shows that actually pain is way more complex than just that sort of sensory input, that there's a whole host of things that can impact on it, we don't really get much exposure to that. So it is quite surprising, I think, and like Kate said, there's been a lot of work done in terms of trying to educate and upskill health professionals more broadly in the allied health and medical space, but for some reason radiographers really had been left out of that conversation, which seems very strange to us. We're kind of like, how has no one done this yet?
Absolutely, and we did try and capture that a little bit in our study. So we asked radiographers whether or not they received any pain education during their undergraduate training program, and only about 11% of radiographers reported that they did. So there's clearly a pretty big deficit there.
And what are the implications and the risks really of that in practice?
Yeah, so if we really don't have an up-to-date understanding of pain and really have the more historical understanding that it's pain is directly related to tissue damage or disease, that has huge implications for us in radiography, because obviously we're looking at things from a medical imaging perspective and we're looking for pathology on that imaging. So we have a really outdated understanding. Essentially what it means is that there is a risk that we could rely on image findings to really validate someone's pain, because we're not considering the bigger picture and that patient may very well be experiencing pain even if there's nothing that we can actually objectively see.
And I think that's really important, because we actually do have a lot of research that shows that often people have had really negative experiences with health professionals in the past, particularly in the chronic pain space, where you know, we have stats looking at experiences of patients coming through emergency who have, you know, felt as if a lot of the time that they are dismissed or invalidated, sometimes even assumed to be drug seeking, or, there's a lot of really negative sort of perceptions of people, and I think that then compounds when you might have someone who, to scan them, don't necessarily have any objective measures of injury. The assumption, if we're working in that old model, must be, well, they're either faking it or exaggerating or making it up.
They're
So
absolutely.
and so it really is, we need that updated understanding of pain so that radiographers and any health professional who's working with people who might be experiencing pain can actually understand that it's possible for someone to have pain and to be experiencing that very real pain, and to treat that sensitively and with compassion, even where we might not have those objective findings.
Yeah, and you gave in the workshop, it was a fantastic interactive thing.
Thank you.
You gave some really practical examples ranging from language, and this is how for better practice, ranging from language to emotions and thoughts and environmental. Can you give us some of those tips for people for what they can do better?
I would say the biggest one from a person-centered care perspective for me is to actually validate their pain and let them know that you do believe them. That's a huge one for me, I would say, is that if there was going to be a key takeaway as a practical strategy.
Yeah, I think a lot of it comes back to how can we help make the environment feel safe and comfortable in any way we can. So erring on the side of making sure people are comfortable, offering accommodations in exam positioning, which, a lot of radiographers are already doing that.
So as well as looking at those general issues, there's also the added factor of neurodivergence and the need for trauma-informed care.
Yeah.
What are your messages on that?
Yeah, I guess speaking as an ADHD person myself, and I work a lot with people who have experienced, trauma and who are also neurodivergent, I think it comes back to, regardless of the label, we need to be treating everyone as unique. And